idea. Yeah.
Right.
Maybe you can elaborate on that.
Sure. You know, we decided that given the fact that, you know, money has not been released to actually implement the program, we wanted to do something, though, on part of the legislature to indicate legislative intent, support the concept, yet also begin the process of establishing this program as best we could. And so we have what's called a Senate concurrent resolution, number 185, that will actually is looking to develop a task force, a legislative task force made up of primarily the Big Island legislators, both in the Senate and the House, and co-chaired by the chairman of the Senate Health Committee and the House Health Committee, to come to the Big Island, to really use the Big Island as this model, and to look at funding, and to look at other means of actually implementing the program to its greatest capacity. Again, with the idea being that, you know, we're going to do this for the Big Island initially, but then we do want to share it, of course, with the rest of the state, because there are, as I'm sure you all are aware, there are needs throughout, particularly on our neighbor islands. And so this is a, you know, an effort to do that. Now, you know, what I would encourage people to do is, and hopefully we'll have some information about how they can provide testimony on the Senate concurrent resolution. So, you know, we have not yet scheduled hearings for it, but there will be that information found on the Hawaii State Legislature website that I think is being broadcast to everyone. And then all you need to do is reference SCR 158. 158 is the correct number.
Great.
So, you know, this is another, I think, way of generating community support.
Yes.
Showing people what can be done if we collaborate and work together. And, you know, I think it's, again, just complimenting all of your great efforts.
That would be great.
And I think it'll be sort of a catalyst, yeah, where, you know, all the anecdotes that you talked about, you know, people jumping in, people wanting to help, and then hopefully through, you know, the discussion on the resolution, helping to allow more people to be educated on the kinds of efforts you're making and how, you know, others who want to might be able to participate and sort of work hand in glove, you know, in those aspects. Because I think what you said earlier, June, about teamwork, both you and Lorian, and actually that's what we're trying to capture too. And, you know, Bobby has been part of, you know, that effort where, you know, it takes everyone, yeah?
Yes.
And so hopefully this will be one more tool to help bring about another success.
Feels wonderful to have your support, most definitely. It brings a group together more so.
And the fact that you have Julie helping, you know, on the grants search side is she's the master.
Yeah, she is. She's a she's a real taskmaster too. So it's been great.
Yeah. We have a wonderful board, very committed, and they all have very great talents, different areas.
Well, that's why the ER, I mean, and you know, one of the statistics you didn't mention is that the ER is the second highest utilized ER in the state after Queens, you know? And so, again, it points out, though, the fact that people rely on the emergency room because they cannot get primary care from other, you know, physicians. So that's what's important. But I really want to thank you all for being here again to help build this foundation for this program to go out and gain as much community support as possible. I want to thank you for all the good work that the Hawaiian Medical Center Foundation has done to date, and you know, obviously you're going to continue to work hard and harder for the community, and you know, I can't tell you how much I know that we all appreciate that as elected officials in whatever capacity. And you know, we want to help, so you let us know how best we can do that.
Thank you.
We certainly want to thank both of you for allowing us to tell our story, because this has really, I mean, Naleo is broadcast island-wide, and so this is one really good way of, you know, publicizing the need and our efforts and what we want the community to assist us in. Thank you very much.
And since we're reaching all of those people now, right?
Yes.
If anyone is interested in joining you in becoming a part of this, you know, effort, is there contact information or a person they should?
I have it right here.
Well, here we go.
To share. Thank you. Thank you. Thank you.
Oh, there it is. Great. You know, let me use this as a kind of a segue to talk about what's coming up next for this series on trying to solve the healthcare crisis on the Big Island. as I did mention that, we're going to follow up with the other 3 initiatives, which is taking a look at our Hawaii Health Systems Corporation structure, and that's going through some legislative review at this point in time. But we also do want to talk about our community health centers, because they are a very, very important aspect of our healthcare system on the Big Island, and including our Native Hawaiian health programs. And I really want to get that opportunity out for our public to fully understand. And last but not least, I think is the critical issue about our long-term care beds, and the need to develop more of that as our population ages, and we want to give them the due respect and provide them with the best possible living opportunities. So with that, we want to thank all of you, and we look forward to being with you again soon to share more information. Aloha.
Thank you very much.
Thank you very
Thank
much,
you.
Thank you.
June, Lori.
Thank you.